Hi everyone, I hope you guys are keeping well. In this video, I have a special guest, Mahesh, who lives in USA, and he's been suffering from chronic lower back pain for the last 12 years. That's correct, 12 years of back pain. In this video, I would like to share with you his results and how's he getting on right now. And I would like to share with you a hope that you do have a chance to recover after 12 years of lower back pain. He's been technically pain-free for the last 12 weeks, and in this video I would like to share with you how's he getting on, what we've been going through in his plan, and how's he doing right now. If you're suffering from chronic lower back pain, this video is for you, and I would like to share with you that you do have a chance to recover even after 12 years. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. If you haven't subscribed my channel yet, make sure to subscribe and don't forget to press that like button. Let's get started. Literally, I suppose before we start, I would love to maybe just give like a brief idea of what was the initial problem, Mahesh, because we started your program like more than 3 months ago, right?
Mm-hmm.
Maybe just tell the story, because you had like a chronic back pain over like, I don't know, 8-10 years. Maybe you tell them the story and we can move on forward and see where you're at today.
Sure. Yeah. So I've been having chronic lower back issues for several years. I've had at least 3 to 4 times of major back spasms. And the last trip that I had to go to an emergency because my pain became too much to handle.
Gotcha.
And this has been going on for a while, so that brought down my confidence a lot. I ended up doing less and less things. There was a point that I wasn't even lifting 5 pounds of weight because I was afraid that I could, increase my back pain. So yes, yeah, I was almost confident that there's something wrong with my lower back, right? Like something bad has happened.
Of course. And what was the initial problem? Did you had an injury, Mahesh? Did you strain something? Did you had a fall? What happened?
While playing volleyball, that was my first major episode almost.
How many years ago was that?
12 years ago, 12 to 15 years ago.
Got you.
When I was jumping, I think there was some major muscle pull that, that I just fell down and I couldn't move. I had to be carried home, and the pain lasted for 2 weeks. The spasm lasted for almost 2 weeks.
Mm-hmm.
And that was a major. After that, I had 2 or 3 more episodes of similar in a spasm. Yes.
And did you got seek help from like a physio, chiropractor? I don't know, because you live in US, right?
I've been to 2 different chiropractors. I've been to the regular orthopedics, where they suggested physical therapy. I've been to two physical therapy, on-site physical therapies. But yeah, the problem kept on coming back. Nothing much. It didn't give me enough confidence to do my regular activities. So I stopped playing tennis forever. Stopped playing basketball. Stopped doing all activities that require a lot of physical activity.
Got you. Anything that kind of like put you back in any sort of strain, I suppose.
Yes.
And did they recommend you that you should go back and play, or did they give you any guideline what you have to do actually?
Nobody ever talked about this. We rarely, discuss these things with physical therapy. Most of the time, they suggest to do some physical therapies, but rarely follow up on this. So we never had a chance to discuss, these things.
Got you. And then you end up in some stage that because it was not going away, you got some MRI. When was the first time that you got your MRI? When was it?
My first MRI was in 2019 when I had another muscle pull because I drove for 8 hours, without much breaks.
Got you.
And it really tightened my body. So that's when I decided to get an MRI done.
Yeah. Mm-hmm. And you did the MRI, and what they told you, Mahesh? Like what was the problem?
So there is, there are signs of disc degenerative disease. There is a little bit pinching. Not pinching, but there is some disc bulge towards the right.
Got you.
Which can potentially cause the issues I have.
Mm-hmm. And basically, I think that knowing that you had a disc bulge, I think it created more fear for you to even use your back more.
Yes, I was convinced that there is some big problem with my lower back.
Yeah.
And there have been several times where I even thought about having surgery done. And I did also make a few calls to make an appointment for with
Surgery.
surgery. Yeah.
Okay. And what happened, Marsh? You
Yeah,
contacted
so
them?
the calls, every time for surgery, they always need an MRI, and they don't take admissions directly. They need my personal my doctors to
Got
recommend.
you.
So I didn't take that step, the next
Of
step,
course.
and yeah, I mean, surgery was in my mind most of the time.
Yeah. And when I suppose when we start to then you start to basically search around, and we start to work start basically your plan. When we start your plan, maybe give me some feedback. What was kind of like, because the initial symptoms were like, certain things that I think we're trying to clarify for you. What did you find about the initial consultation that was helpful, Marsh, in
Yes,
your own words?
right. The initial symptoms I had were the pain in my right side of lower back, and the tingling sensation in the right leg, numbness and weakness. These were the main symptoms, right?
Gotcha.
And of course, the mental confidence was at all-time low. I couldn't even lift anything more than 5 pounds. While traveling, also, I don't lift anything. So every time I travel, I have to keep in mind, like, am I sitting too long? Am I going to stand too long? All these things.
Got you.
So I was in that state. Um, as far as the expectations from initial consultation, I didn't have much. I thought, since I've been to so many physical therapists, chiropractors,
I got
massage.
you.
So yeah, I mean, I thought, why not let's do one more time, before seriously thinking about surgery.
Got you. Got you. Yeah. And what did you find helpful in overall in the consultation? Like, did you find like you got the different approach out of what we discussed?
Yeah, I think the most helpful thing was the talking, the discussion that we had, the reasoning behind my pain, the mainly I think the point that I really liked was that, when you said that I probably am fine, I'm not really using my back, pushing it more. Probably everything is just fine, right? I'm just not using it. My pain sensitivity has increased. My nervous system has become very sensitive in that area. Um,
You remember very well, Marsh. I'm happy with
yeah.
you. You have a very good memory. Yeah, that's very
Right.
good.
So the idea that, you should start using it more, you know, uh, you know, learn, let it learn the different motions, the different weights, the different, so that kind of,
Yeah.
resonated with me. I think, I'm sure you're right there to a great extent, that I wasn't using my back properly. I was
Got you.
protecting it way too much than I should have. Yeah.
I know, because I do remember even like sitting wasn't comfortable, and we were discussing if you seeing friends or in work you don't sit long.
No, I answered. Yeah. Yeah.
Yeah. What was it? How bad was it, Marsh? Just
It
because.
was pretty bad. It was pretty bad. So bad that every 5 minutes, I would raise myself up. I would not put my weight on my lower back. I used to, keep my hands, I used to do this
Yeah.
so that please my lower back. And I used
Got
to do
you.
this every 5 minutes, right? Every 5 minutes. It's some people noticed it,
Yes.
but when I drive, I do the same thing every 5 minutes. I try to, so it was pretty bad. It was in my mind all the time.
I got you.
And I go to a restaurant, I sit on the corner seat so I can get up. I go to a movie theater, I sit on the edge seat
It's
while everybody's sitting in the middle row. So, I've seen movies standing up, go back and stand up. So yeah,
got you.
it was pretty bad.
Got you. Yeah. But I mean, that's amazing, man, because I think you've done really well over the last, I suppose, 3 4 months, man. Like you're totally a different person. I can see that, man. You're much more happier.
Mm-hmm.
in overall. And I think that mental confidence has definitely come back, with basically having a bit of structure to what you can do and what you should do, and simply challenging you, because the program that we're doing right now, that the stage that you got right now is not an easy plan. How did you find the training, Marsh?
Training was good. It was progressively improving. So, and it was not too hard to do it. It's something very similar to what I was doing before, but some new routines, that probably helped me quite a bit. And I stopped doing something that I was doing before, which probably were not helping me much. So
Like what, Marsh? Maybe explain that. Like what
yeah,
wasn't really helping you?
I used to do this, for example, the hamstring stretches. I used to think that they were helping me quite a lot, but
Yeah,
not much. Yeah, and I used to do this McKenzie quite a lot, but that probably was damaging more than I was benefiting from it.
I
So
get
I
you.
stopped doing that. Pushing myself too much to do the McKenzie exercises, so that I stopped. I mean, I'm still doing it, but not as much.
Of course. Yeah, I think this is a very good point that you mentioned, that sometimes by doing too much of something, your body might actually get more oversensitive, than actually get the benefit. You don't want to like increase the volume of things too much that your body become very sensitive. And as part of your plan, you pretty much still doing McKenzie's, but it's not about McKenzie's or stretches are good or bad. We're not trying to demonize them, but it's about movement is in overall is the best thing that we know by now, by fact that it helps with back pain, especially chronic back pain, with disc bulges, with sciatica pain. Movement is something that hugely helps people to recover. But I think that's a really important factor, and you were really paying attention to those details, that you knew that, okay, I have to stop these, and we discussed about it, and like the way that you were holding yourself, you know what I mean, constantly, that stopped. And like, those are very, very important factors that really mentally drain you, man, through the day, because you can't switch off from your back, doesn't it?
Right.
And you reach the point that it's just become like whole your life, goes around your back. And that's excellent. And Manish, I suppose, like, I want to know, if somebody who has back pain or something similar to you, do you think this program can help them, or do you think the clarification that we had on the initial consultation, over consultation that we had, do you think that helped them to answer the questions? Because I think there's a lot of question comes to people's head that they can't have a chance to sit down and talk with their physio or chiropractor or their neurosurgeon or orthopedic, and we discussed through things that I can answer, you know what I mean, as far as I know. Do you think that is helping you to get more confidence based on doing things that you do by now?
Yes, that is one of the differences I found between talking to my orthopedist and the physical therapist I have had before. So they rarely talk about, any. I mean, they don't talk about my history as much. They really try to understand it, and I guess part of the reason is they've seen so many different patients, they become callous to it, and they think that the solution for every back pain is the same, and they ask me to do the same thing without knowing what exactly is my problem, or without discussing
Background.
much, going deeper into it, right? So I think that's one of the differences I found with talking to you, right? Where we went through the history, where you try to understand like what exactly is wrong with me, and how am I using my body, those things, those kind of questions. Basically, you figured out that maybe I don't have much problem, maybe I don't have any issue, right?
Yeah, absolutely.
Right. Yeah. So that discussion did help quite a lot, and yeah, I mean, talking helps, to understand the nature of the lower back problem, because it's quite complicated. I understand that. I mean, there's no one solution for the back pain, but
Absolutely.
talking about it does help a lot. Yeah.
Absolutely. And reasoning it, because I think you do have that understanding now that maybe I was doing too much of protection rather than actually using it,
Right.
but you try, and then you see actually the results by doing more. You don't have more pain, you know what I mean? And you're in a state right now that, how would you describe your symptoms right now, Marsh? Like after doing like you're doing now deadlift, you're doing squats, you're doing lunges with 30 pounds, right? And
Right.
these are pretty advanced exercises that average people with back pain would avoid doing them.
Mhm.
And how would you see symptoms right now, Marsh, like in regards to discomfort, or what, how would you call it?
Right. Yeah. So I don't get any pain by doing any of these exercises, right? It actually makes me feel better. Once I do this, especially the squats and the lunges, and within a day, within 24 hours, I feel absolutely no pain at all. I feel more confidence. I feel more stronger. Um,
Amazing.
I do still feel issues. I mean, find issues when I don't do them and I sit for a long time. So
Yeah.
yeah, it's still there, but as long as I'm doing these exercises, the workouts, the mobility exercises thing, it recovers fast. And
Amazing.
yeah, when it's recovered, I don't feel any pain at all.
Exactly. And I think you managed to try playing tennis again with your kids, and not as much
Yes,
as you want, but I think that was another trial that shows I can do something
right,
outside of my comfort zone. And I suppose in part of this plan, I really push people out of their comfort zone, because by protecting and doing less, you adapting to that condition.
right,
And that adaptation can be vice versa, which means we're trying to get you adapted to stronger version of yourself, not just a matter of strength and matter of like repetition. Because in chronic lower back pain, one of the most important thing is not only strength, is endurance strength, which means be able to repetitively doing the same activity over and over again. And I think
right.
you usually manage that, to gain that. And I'm delighted, March, with your results. Thank you for sticking to the plan, because it just is not an overnight thing that to achieve. It's something that you earn it, and you have to know that your body didn't got to this stage overnight. It's
Mhm.
like 12, 10 years of like, back pain experiencing with it, protecting, and I believe you're in a really good stage right now. We keep progressing your plan. That's one thing that I know. And I suppose, is there anything else that you'd like to share, Marsh, with people?
Yeah, I think talking in every session helps a lot. I try to get to the bottom of it. What exactly is the pain? And sometimes there could be actually no pain at all. I mean, no issue with the lower back at all. It could be just that you just need to do some more. Push yourself a little bit more. Make it a little stronger.
Absolutely.
So
Absolutely.
yeah, I think. The point is to stick with the plan, keep talking, measuring the progress, change it if required, but keep talking, that's a big thing. Yeah.
Keep pushing it forward. That's brilliant, Marsh. Listen, thanks again for your time. Thank you for sticking to the plan, and we keep you on track, and we keep pushing you forward, man. Thanks again. I really appreciate your time, man. I hope you guys find this video helpful. If you have any question in your mind, you can leave me comments. If you need further assistance, you can always book an online consultation with the link below, and we can go through your case and get you started right away. I believe every single patient who suffers from lower back pain has a chance to recover with conservative treatment. And if you never try, you never know what would be the chances that you can recover and get pain-free. You can always contact me through my website. If you haven't subscribed my channel yet, make sure to subscribe, and please press that like button. Until next week, all the best.